Okay? Yeah, yeah. Are you coming out? Okay, all right. All right, we'll get set up. All right. Mm. Okay. Can I get, I need my, will you all be there? Congressman, can you see me?
Yes, ma'am.
All right, you're on. You're, as I say, you listen to me, and then I'll yield to you. And let me introduce you to the best team of medical professionals. This is Congressman Vicente Gonzalez. So when we're fighting, we got to remember United Memorial Medical Center. This is Dr. Barone.
Very nice meeting you.
Pleasure.
This is
Thank you for all you do for us.
Thank you very much.
Good morning. Chief of everything, and this is the Chairman and Chief Executive Officer, Saeed
morning, sir.
Mohid. And you're
It's a pleasure.
you're actually at it. You can actually write down the letters UMMC, so you'll know when you speak where you are. UMMC. You got it?
Yes.
Okay.
Well, I'm in DC. I'm in Washington.
Oh, okay. That's fine. But you'll know where. Right. But I'm saying you can say where I am. Okay.
Okay.
Yeah. Can you all? This is not working. Is this working?
It's not working, ma'am.
No.
I'm going to put it
Yeah.
out of the way if that's all right.
Yes. Thank you.
Hello?
Do you have the boom? Is the boom thing not working? Hello?
Get it.
Huh?
But this might fix you up. This mic will fix you up. This one will just be there for an audience. But we
Excuse-
don't have an audience.
Testing. Testing. It's not green. I don't think it's testing. Okay, never mind. What are you doing? Is it dead?
Oh, they're looking at it.
Okay, you need to put it back in the car. Okay, guys, you can come on up. I know you're in there. I'm just going to take
My
this.
vitamin D dose for the day. Well, I'm truly losing it. After 108 days, I'm losing it.
Testing. Can you all hear me? Okay. Good morning. We're here this morning because the nation is in a crisis, and certainly our state, the state of Texas, is in a crisis. I'm here this morning with Congressman Vicente Gonzalez. We work together as a member of the Financial Services Committee and the Foreign Affairs Committee, and obviously, as it relates to the Foreign Affairs Committee, the United States has been banned from coming into or going into the jurisdiction of the European Union. With that in mind, it is important to recognize that we're almost at 3 million confirmed cases of COVID-19 in the United States, 130,000 deaths, 182,000 cases in Texas, and almost 3,000 deaths, 2,457 deaths, and then almost 30,000 cases in Texas and 371 deaths. In addition, many of our citizens here are in quarantine because they've been exposed to people with COVID-19. In the 24 hours that I have come home, I have spoken to people whose family members have come to UMMC, have gone on to emergency rooms, have tried to get tested, who are in crisis. And I want to acknowledge our local leaders, the mayor and county judge, because they have been fighting every day to ensure to stop community spread. Dr. Fauci testified in front of the Senate when I was in Washington, in front of all of us, that we're now at 40,000 plus new cases a day. If we keep that pace, he expects that it may go up to 100,000 cases a day. Texas is an epicenter, and we should not shy away from the necessities of what we need. Every day there are people coming into this emergency room, emergency rooms around the city and county and beyond. Dr. Fauci has also said that he is not satisfied with what's going on because we're going in the wrong direction. We're going in the wrong direction even here. Even as we have heard new orders being presented, we're still going in the wrong direction. If you look at the curves of the new cases, Dr. Fauci said, we've really got to do something about that, and we need to do it quickly. And as a member of the United States Congress, there are several things that I want to propose for us to do quickly. On this past week, both the congressman and myself wrote a letter to the governor of the state of Texas. We wanted mandatory masks. We wrote that way back, and so the governor did make an announcement in the last 24 hours of mandatory masks. We want to make sure that it can be enforced, and he must give the authority to the local jurisdictions, mayor and county judge, all over in counties and cities where we are soaring with COVID-19 patients. We must have the authority to enforce wearing a mask. Secondarily, I believe that the economy is crucial. I believe that the need to help small businesses is vital. And so as of this week, we voted and passed $134 billion for PPP. That is $134 billion more dollars to help our small businesses get through this crisis, including our restaurants, including our faith institutions, nonprofits. And the HEROES bill is waiting to be signed that will give more money for testing, hospitals, and our small businesses. But it is important, as we wrote, that we need stay-at-home orders to be given through our local mayors and local county governments based upon the science and the numbers of cases we have. Harris County and our city are prime recipients and beneficiaries of a potential stay-at-home order. We want the science to be governing, not anything else, not people's whims or feelings of denial of freedom, but it has to be the fact that science tells you that this is what we need to do. In addition, it is important that we advocate by all of our members, the entire Texas delegation, because of where we are, need to push the United States Senate to be able to vote for the HEROES Act, get going, so that this money can start coming to our local communities. I would also indicate that we are facing the Republican convention that is coming. We would hope that the Republican convention could be virtual. There could be some way of addressing the question of large numbers of people coming indoors, many not wearing masks, and creating a health crisis again. This is not a political question. This is a question of safety and the various first responders that will be engaged and all of the support staff that is necessary. Let me be very clear that the HEROES Act will provide resources for hotels and all of the hospitality industries that are suffering because of the COVID-19 shutdown. We're going to get through this. I have faith that we're going to get through this. Tomorrow is the nation's birthday. It is a birthday that we hope will be celebrated for all of those who love freedom. And it will be a day to reinforce that freedom should not be for one group and not another group. It should be for all groups, no matter what your race or color or creed, what your age is. Your freedom should be for everyone. With that in mind, I want to make sure that we celebrate it correctly. And the idea of a convention coming in this month where our first responders will be exposed is a question that we must address. Finally, I would offer to say that tomorrow is a celebratory moment. The celebratory moment is when people get together. A message to young people. Please, COVID-19 is not a stranger to you. You are not immune. Social distance is imperative. And with the social distancing, we can save lives. Have fun, have virtual barbecue, eat the barbecue, do your friends over virtual, listen to the music, hang out, have your freedom, but make sure your freedom is about others' freedom. That is the case. So let me now bring up the representative chief medical officer who has been guiding along with the CEO through UMMC close to 80,000. It's 74,726 patients, and they have completed 72,745 samples, the most of any institution here, and they're processing 1,981. Dr. Verone has always told me that the positive rate when we first started testing was 7%, 8%, 9%. We were actually seeing the reality of people being positive. No one else was seeing it. We're now at 11% positive. Our sites are Tidwell, Forestbrook, and Cullen that we're testing. And of course, there's one out in Fort Bend. We found that there are symptomatic people. 52% of them are symptomatic, and 46% are asymptomatic. That is a big jump. That is an important number to indicate that we're in crisis. We need people to listen to us, and we need as well to bring as much help here to this community as possible. Dr. Verone. Is he ready? Okay.
Well,
Would
go
you
ahead.
yield,
Yeah,
Dr.
please.
Verone?
Please.
We were just checking on the technical. He's ready.
All right, just the sun is overheating.
But is he still there?
You still there? Okay, we can hear you, Congressman.
All right, so it's my pleasure. Congressman Vicente Gonzalez, we wrote the letter together, and we appreciate your presence. Thank you.
Thank you, Congresswoman, and I thank everybody for bringing attention to such an important issue that we're dealing with in Texas and other states across the country. Clearly, the early opening of our state and others across the country have been a strategic failure, and we've lost lives. In my district, for example, we're at 1,000% increase in hospitalizations. People are dying every single day. We're busting at the seams at all our hospitals. We need more help from the state and the federal government. We need more healthcare providers. We think the National Guard should start opening up facilities to care for the overflow coming from hospitals. I'm particularly concerned that a lot of the funding that's come from the federal government to the state hasn't been dispersed yet, especially in our rural communities and our small counties and small cities. We've allocated $8 billion, and very little of this has gotten to some of our most needed smaller communities. So we're still asking for this help. Clearly, not the mandate of wearing masks was a good one. I think it was a little late, but it's good that we have it now. I think it should be an order nationally, and I think that what's happening in our communities should be a lesson for others that haven't been impacted as we have. To wear your mask, keep your distance, wash your hands, take care of yourself. This is no joke. People are dying out there. People are dying in our communities, and we need to come together. This is not a political issue. It's not a red versus blue. It's a red, white, and blue. And we need to come together and get this right. It's not time to play politics, and we can't open states up according to President Trump's political agenda. We have to listen to the CDC, the WHO, our local healthcare professionals, and do what's appropriate for the American people.
Thank you. We're going to put you in the shade for a question if you can hold a moment, okay? Can you hear me? Thank you so very much. I just want to emphasize that was the reason why the congressman joined me in this letter, because we're both facing really contiguous crisis. Houston is South Texas. It is in the southern part of Texas. He's in South Texas. He's seeing a rising number of deaths. Here in Texas, we're seeing in this part of the state of Texas a rise, but we're also seeing it in big cities like San Antonio, Austin, Dallas. We need a response. We've got to have the ability to have stay-at-home orders. We've got to have the ability to move beyond some of the things that we've been talking about, and we've got to have ability for people to socially distance and not be in large groups. That needs to be in order as well. Dr. Verone, you have to tell us what you've been seeing. Thank you so very much.
Good morning. Thank you very much, Congresswoman. The fact is that this is not a hoax. We're going through one of the worst things I've ever seen in my medical career. I mean, the pandemic has gotten really bad, particularly in Texas. We have had to make extra beds in our institution, and we've been also on the front line of what's going on COVID. And all my friends around the state tell me that they're going through what we are going. We have tested more than 75,000 people. Our positivity rate has clearly increased, has skyrocketed. But the scary part is that those people that are positive, 48% are asymptomatic. 48%, that means you don't know who around you has it. So people, please, tomorrow is Independence Day. And I truly believe that how we behave over the next 24 hours is going to guide what happens to us for the next month. If we start going to places and start having, all these barbecues and thousands of people together going to the beach, I guarantee that we will be here for a long period of time. Therefore, I ask you, I implore you as a healthcare provider, stay at home. Do your virtual reunions. Use the technology to your benefit. Thank you. En español. Estamos aquí el día de hoy para hablar con la congresista Shelia Jackson Lee sobre algunos de los puntos importantes que tenemos en la pandemia de COVID. Desafortunadamente, estamos viendo que el número de hospitalizaciones está subiendo, tenemos gente que se ha puesto muy, muy mal, y no nada más con nosotros aquí en este hospital, en hospitales alrededor de Texas. Mañana es el Día de la Independencia de los Estados Unidos. Mañana yo pienso que nos va a establecer qué va a pasar con esta pandemia si hacemos las cosas mal. Es decir, si salimos a hacer grandes barbecues y nos metemos en grandes fiestas, esta pandemia va a continuar por un periodo muy prolongado. Yo les imploro que se queden en sus casas. Yo les imploro que no salgan a menos de que tengan que salir. Y si van a salir, que usen su mascarilla, que mantengan su distancia social y que tengan medidas de higiene muy importantes.
I want to again thank both Mr. Mohedin and Ms. Hebram for just the heavy work that's going on here. I want to thank the nurses and doctors across this landscape of this region and across the state that are around the clock. And I want to conclude by saying certain things that we're going to be doing. We're going to be standing up a mental health component, working with Dr. Janice Beal. I'm home to work on that this coming week. We are very concerned about people who are in quarantine, who believe that they have no outreach, very concerned about their mental health status, and we want to work with the local mental health agencies to really push them with a number that they can be reached. They all have their individual numbers. We'd like to see if they can be one integrated number that they can get individuals mental health assistance, which I think is very important. We want it to be multilingual. That has to be done. Secondarily, we are in need of health care professionals. We need nurses and retired nurses. If you're able to come forward, please let your health facilities and hospitals know. Please let UMMC know if you are able to come forward at this time. Finally, I believe that the order of the mandatory mask. As my colleague has said, we wrote the governor on the first day of July saying it is imperative that you issue this order. I am grateful that he issued this order. I wish it was a couple of weeks ago. But we cannot do it with a mandatory mask alone. You have got to allow enforcement of that wearing of the mask in a way that respects the rights of all people. All people's freedom is dependent on me respecting their freedom. That means that we need expanded orders. And the congressman and myself are asking to allow cities and counties to issue stay-at-home orders that are enforceable by science, by the medical professionals in the area. And we will respond to the needs economically with the passage of the $3 trillion plus HEROES bill, which we expect to be passed in short order to provide for hospitality and restaurants and testing. We cannot carry on in the way that we are, spot check, stopping, saying that people should do this. There has got to be a pause so that we can stop the community spread. That is not Congresswoman Jackson Lee speaking. That is Dr. Fauci speaking, Dr. Verone speaking, that is the NIH speaking, that is the CDC speaking, and that is the European Union speaking, that says that we, United States citizens, are not allowed to come to Europe. When have we ever heard that in the history of our country? When have we ever heard that we've been banned from coming to other countries? We are banned because our numbers are outrageous. I'm now going to let Congressman Gonzalez be part of answering questions. We'll open it up for questions now.
He said you can do answers in Spanish.
Following that we are banned from traveling to other countries, that countries are looking at us as deficient in the way we've responded to this virus. Clearly, we need to get our house in order. We need to do what's right. We need to come together as a country, as communities across this nation, and do what's appropriate from the top down. As I said earlier, this isn't a time to be playing politics with people's lives. We have a responsibility as elected officials. We need to get resources down to places that are going through critical urgencies, such as the Rio Grande Valley and other places in Texas, in Houston, Corpus Christi, San Antonio, other areas across the state and across the country need these resources. We need to get the federal funding that has been allocated to the states to the people who need it most. And we need to allow our cities and counties, as the Congresswoman said, to be able to have the power to issue stay-at-home orders or whatever it is that they need to keep people safe, healthy, and alive.
We'll take questions now. Hold on, Congressman. There may be a question. Yep.
What do you say to those people, for example, the county judge from Montgomery County? The governor says that no congregations are more than 10 people, but he left it up to the counties, like you said, the right to decide whether they open those groups or not. The county of Montgomery County says that they're going to allow those groups to happen this weekend, especially. What do you say to those that still do not agree with the mask order or any other type of restriction order?
I will give you the question. You'll hear me speak, Congressman. Well, first of all, tomorrow we're going to be doing testing, and some of the people that are going to be helping us are men and women of the United States military. Whenever you think of the United States military, you think of freedom. And when you think of freedom, you think of sacrifice. And what I would, how I would respond is that as we commemorate the nation's birthday, it was about freedom. When we ignore the rights of others, we deny them their freedom. When we ignore the absolute basis of science that talks about community spread, the way that COVID-19 now can be spread, the number of feet that it can be spread, and we ignore that, then we are denying people their freedom. I would hope that all of the elected county officials, if given the responsibility to issue orders, would issue them in the name of protecting the health and safety of their population and base it on the freedom of all people. Because by not adhering to orders of social distancing, You may be denying an elderly person their freedom, a person with underlying conditions their freedom, a teenager their freedom, a person who has just finished chemo their freedom, a person who is not sick and becomes sick their freedom. So my answer is that we all have a personal responsibility to be able to be sensitive to our duty. This is about duty. The congressman said this is not partisan. It is about duty. And the duty is that we must have everyone protecting everyone. To that county leader, you need to protect everyone. Congressman, the question was, what do you say to county leaders that ignore orders of mask or social distancing and indicate that they're not going to do that? Did you hear me? Are you there?
Are you there, Congressman? No, it's too hot. Computer's too hot.
Well, take him away and see if he'll come back alive. Well, I obviously represent the county and city in terms of a large part of the jurisdiction, and yes, I don't want to speak for the judge. I'm aware of what her thoughts have been, and so I keep in contact with the judge and the mayor. Those decisions, if the authority is given to either one of them or both of them, I have confidence that they'll make the decisions based on science, but it is imperative that they have the authority to do so. Because there is no doubt that it's Harris County and Houston's hospitals that are overwhelmed, that the emergency rooms are overwhelmed. You've heard what Dr. Verone has said. The numbers are unspeakable numbers. And in addition, we're overrun with the need for nurses. We need medical personnel. Why do we need them? Because more people are walking into emergency rooms, coming into emergency rooms, looking for help. So yes, we are in dialogue, and I would imagine if the orders came and their authority, they'd make their decisions based on science.
What kind of input are you getting from your constituency as far as kind of going back to shutting everything down as we did back in Harris County, Houston, back in April?
Well, first of all, what I'm hearing is a lot of fear about COVID-19, and they are looking for some stop sign that says that there is an end to it. We can't give them that. So I think what I'm hearing is that the community wants leadership from its elected officials, from its government, to protect them, and that they're willing to listen if it is with the authority of an order, and they realize that it will be based not on politics, but on science. Community spread is real, COVID-19 is real, and decisions can be made that are real, if you will, based on science. And my constituents just want this to be over. They're sick. They want to not have to be quarantined because COVID-19 is still here. So they're looking for answers, and they're looking for their government to give them the right answers, and particularly in the jurisdictions in which they live. So I think they would welcome a decision based on facts, based on science, and based on caring about our neighbors and our constituents.
While you were speaking, there was an emergency alert that came out from the state of Texas. It says the state of Texas now mandates all residents wear masks inside buildings that are open to the public and outdoors when it is not possible to maintain 6 feet of distancing people outside of their houses, punishable by a $250 fine.
You can see by that order and the fact that it was an emergency alert that we're just short of what we should do. Obviously, the numbers are going to rise, and we're fearful of tomorrow. And so it is being issued for indoors and outdoors, expecting what is going to happen tomorrow. That means that real consideration should be given to allow our local jurisdictions to go ahead and move on a stay-at-home order. Because the fear is that you're not going to have 10 or less. You're not going to be able to do social distance. So the interim response is put a mask on. And that's all good, but masks will come on and off as I take mine off. And so it is crucial that we begin to come together as leaders of the state, the federal government, members of the United States Congress in their respective jurisdictions, their local officials, act on science and do what we need to do as relates to safeguarding all of our constituents. And I have one more speaker, if I could. I mentioned Dr. Janice Beal for a brief moment, and let me Dr. Janice Beal has over 2 decades of experience in mental health counseling and is a viable leader on this issue, and I'm just delighted she was able to join us to get away from her patients. So she works around the clock. She has a 24-hour service where she works at night and the day, and I'm delighted she was able to get away. Dr. Janice Beal.
Thank you, Congresswoman, for allowing me to speak right this afternoon. Yes, I am so concerned right now because it appears that people are more fearful this time around than they were the first time around. We've had a lot of calls with anxiety from children, adolescents, and adults that everybody's concerned about what to do and how they're going to respond, especially since the numbers are rising so rapidly. It's important that people learn how to cope and how to address the anxiety that they're experiencing. We've had households that have been disrupted and households that have come together in order to be able to combat what they're experiencing during this pandemic. So it's important that people take care of not only their physical health, but their emotional and their psychological well-being. We're in the process of trying to do another hotline to be able to address some of the fears and anxieties that people are experiencing that will be coming up and be starting next week. We will talk to them and be able just to have somebody just to talk to, because a lot of times people just want to have someone to talk to. There are a lot of people who are at home and who are older who may not have family members that have not had any access. We're people that are accustomed to reaching out and touching each other. And because of the pandemic, we are not able to do that. So I caution everybody that's coming up this weekend to please follow the rules, because if we don't follow the rules, we'll be in this a lot longer than we're anticipating right now. So what I see is a lot of sadness for college kids who aren't able to go back to school. I've just gotten calls from all ages, so it's everybody's having an effect on what's taking place at this particular time.
Spell your name and specify your practice.
Your credentials.
Okay.
If anybody wants to
Okay.
coach you.
Again, my name is Dr. Janice, Janice. My last name is spelled B as in boy, E-A-L. My practice is called Beal Counseling Associates. That's my last name, B-A-L, Counseling Associates. Our phone number is 832-748-4762. 832-748-4762. Again, thank you for allowing me to speak and talk about. Oh, I have a doctorate in counseling, guidance, and psychology, master's in clinical psych. So I have been practicing from the mental health perspective for 29 years now. So I've been in all aspects from research to actually being a clinician and a practitioner. So very much so, I've seen a lot of different not pandemics, but a lot of different things that Houstonians have gone through, from Hurricane Harvey to Hurricane Katrina, and we've done groups. But this time it's a little bit different. And the reason being it's different is because people don't know when this is going to end. So the uncertainty about when it's going to end has caused more anxiety for people as they're experiencing what's taking place right now. Okay. Thank you, Congresswoman, for allowing me to speak.
Let me close by indicating that we are testing at 7903 Forest Point tomorrow, the only Independence Day testing starting at 8 a.m. And I want to emphasize what Dr. Beal said. I want to close on that because it works very well for this issue of stay at home. If we continue doing mixed messages and mixed procedures, hoping that they work, putting a mask in, keep telling people to socially distance, and people see no end, it becomes more of a stress, a mental stress. If you give them something to do, stay at home, get yourself modeled after staying at home, and they give you a period of time. And then we begin to monitor it by science, and the hospitals begin to assess the intake. Then everybody will think they're pulling together. And you complement that with vigorous mental health support services. That's what we need. People are looking for a plan. They are frustrated by no plan. You told them to wear a mask a couple of weeks ago. Now you're saying it's an order. But they're in a surge, and their loved ones are dying. You don't have a plan. If you go to them and say, we're staying at home for this period, why? Because we want to aim toward the fall to make sure that we may be able to get our children in school. We want to aim toward pushing COVID-19 back because we can stop the community spread. That is a plan. It is not a plan to come out piecemeal. And the plan is for the federal government to own up to its responsibilities and send the $3 trillion out to the American people and to Texas, and to make sure that we protect and provide for those who need it. I just want Dr. Verone, as he sees patients and families, remember, families can't come in. Once the loved one comes into the medical center or any of the hospitals, the family can't come in. Dr. Verone, on the mental health?
The number of cases that we're seeing of people having mental health issues are amazing. I would tell you 100% of the patients that I admit to the hospital, they have issues. I mean, we had a lady the other day that she was calling 911 from her room, saying that we have her kidnapped because you are in a very, close environment. Imagine somebody like that calling their family members and telling them, I feel here very, anxious. They call their family members, everybody gets anxious. Now you have the whole family being anxious. I know that, spending a few weeks in your home makes you very antsy. And I know that our healthcare providers that, deal with mental health issues will be hopefully guiding us as to how to deal with this. But this is a serious issue, as serious as being on a ventilator. Equally important. I mean, people are very anxious. People are getting depressed. The number of suicides in the country has grown up exponentially. We have to look into those issues as well. It's not just a one kind of a treatment plan. We have to look at it globally.
We will conclude. Dr. Beal just indicated 2 doctors have committed suicide in New York. But my point is that if we give the community a plan, if we have a time certain, if it's governed by science, if we have the support systems that Dr. Beal is talking about, and we listen to UMMC and we listen to Dr. Verone on what families are going through when their loved ones are here, and then we have people out in the community thinking it's okay and then saying to us, you gave us an order to come out, it is now worse. Who can we trust? How can we get our hands around it? And there is no doubt that the too early orders to lift up the stay-at-home orders, that is the point, the marker of which our acceleration began. And that means that people lose faith, they lose trust. We've got to regain that trust again, and we've got to get our hands around it. A stay-at-home order, maxed with masks and social distancing and hand washing and mental health services, and helping get us medical professionals, nurses, to come down here to Houston and to Harris County is vital. With that, thank you very much, and have a good day. Sir, did you get the letter? Okay. Did you get all your questions? I know it's hot. Do you like a bottle of water? All right, thank you. Thank you, Alma. Did we last? It stayed on?